71% of women in perimenopause will have musculoskeletal pain. That's why me, a women's health physical therapist, is telling you about the musculoskeletal syndrome of menopause. And let me tell you, the musculoskeletal syndrome of menopause is all the weird stuff that's been happening to you. You've had the MRI, nothing shows up, there's no structural findings, because it's at the physiological level. That's right, you have estrogen receptors and hormone receptors on the tendons, ligaments, and capsules, and your estrogen helps control inflammation and how your body remodels, even your cartilage. So women and men are very different, and men also have estrogen and progesterone receptors in their tendons. But here's the thing. The prevalence of the musculoskeletal pain is far greater in us. Arthritis is far greater in us. Estrogen is an inflammatory regulator that plays a role in preventing all the dysfunctions that you're having. So your generalized arthralgia, your joint pain, the tendonitis, how the tendons remodel, your widespread joint pain, that's 4 out of 10. Estrogen was helping control your inflammation, but it also helped all your other structures remodel. Now, it starts in perimenopause, but peaks in early postmenopause when estrogen is really gone. You just don't heal like you used to. You're more inflamed. The satellite cells, stem cells located on muscle fibers, promote plasticity and regeneration. That's right, you're remodeling. Estradiol stimulates the activation and proliferation of the satellite cells through estrogen receptors. And part of the force generated by skeletal muscle appears to be determined by the binding of estradiol to estrogen receptor alpha. By losing the stimulation that estrogen promotes by binding to an estrogen receptor alpha, muscle strength and recovery after injury are impaired, which is why rest and recovery and self-care is very, very important for you feeling better in perimenopause. You can no longer drive it like you stole it. I need you to do recovery. Recovery sometimes truly means doing a slow walk on a day that you don't feel so great. Maybe doing a foam roller, the massage balls. Maybe you are going to use a massage gun. I take creatine to help me with post-workout oxidative stress. Recovery becomes part of our lifestyle to help us remodel and feel better because we are literally more irritable on so many fronts. Estrogen also helps regulate the extracellular matrix. Cartilage is composed of dense extracellular matrix and highly specialized chondrocytes, cells that are partially regulated by estrogen. This is why arthritis comes for women a bit more. The knee pain, the cartilage. While both mechanical and biochemical factors contribute to the osteoarthritis progression, it is understood that osteoarthritis incidence in women increases dramatically around the time of menopause, and recent literature claims that women experience more debilitating arthritic pain than men. Absolutely true. This is why I'm a women's health physical therapist on this app talking to you about what you can do to help you feel better because you're suffering and I'm sick of it. I am 100% sick of your suffering. So I'm going to teach you how to feel better. I mean, as much as I can teach you, I am just your internet friend. I am not your physical therapist, nor do I play a doctor on TV. But education is power, and you just being here still means you care to learn so you can take care of yourself better. So what can you do to start to feel better? Well, the only thing that's not controversial is exercise. Exercise meaning we walk more to get blood flow. We lift more to help remodel the bones and help make muscles and to help the tendons. We have to load the tendons to make healthy tendons. We have to load the bones to actually have a stronger bone. We have to load the muscle to make muscle. So movement will be part of your perimenopause, menopause coping mechanism along with rest and recovery to help modulate inflammation. But what we eat also matters because if you're eating things that are irritating you and you know it, you're not helping your inflammation. For instance, if I drink Coke Zero all day, every day, it's not good for my pain. It's just not. Along with dietary changes, including increased protein intake and the aforementioned vitamins, which was D3 and K2, omega-3s. I personally take creatine to help with my oxidative stress. Resistance exercise may be critical for women in menopause. Long story short, you have to eat to nourish your body. You have to rest and you have to move. And if you feel like it's a part-time job, it kind of is, but here's the thing. What if we sneak in little changes daily so it becomes more of a lifestyle and not a job? And that's the real way we're gonna make change, is little tiny changes through time. Today that could look like a teeny walk after dinner. It could look like 10 minutes of stretching. It could mean you actually remember to take those supplements sitting on your kitchen counter. It could mean you go to bed in a timely manner and stop doom scrolling. Little changes make big differences over time. Love you, bye. Stop driving it like you stole it. Love you, bye.